Joining us live this morning is Dr. Issac Bogoch, infectious diseases specialist at Toronto General Hospital. Good morning, doctor. Really great to see you. Once again, we're talking about the latest when it comes to the circulation of the measles virus. Now we're seeing, outbreaks in Ontario, the highest numbers we've seen in 30 years. And now March break has wrapped up. So we know a lot of people have been traveling over the course of the last week or so. Do you expect we'll see those numbers continue to go up?
They'll probably go up. I'm not entirely sure how much of it will be driven by travel. We just know that within Ontario and within Canada, most people are immune. Most people born before 1970 have been infected and recovered and are presumed to have lifelong immunity. And most people born after 1970 have received their routine childhood immunizations. The issue is that there's pockets within Ontario, within Canada, and of course globally, that are under-vaccinated. This virus is so transmissible, it has a knack at finding those pockets and exploiting them, and that's why we're seeing these outbreaks. So the key thing here is really checking your immunity status, your vaccine cards. If you're not sure about it, speak with a healthcare professional, a family doc, a public health provider, a nurse, a pharmacist. And of course, this vaccine is free, it's safe, it's widely available, and it's very effective in reducing the risk of measles.
Can we talk about just how contagious this virus is?
It's probably the most contagious virus on the planet. So this is, one of the examples that's given is, for example, if someone who has measles enters a room and is present in a room and then leaves that room, the virus can hang out in the air in that room for even a matter of hours. So if a non-immune person walks in that room, an hour later, there's a high likelihood that that non-immune person will get measles. It's just a tiny virus. It floats in the air. It can stay suspended in the air and travel distances and infect people. And the infectious dose, the amount of virus you actually need to be exposed to get infected is minuscule. So it's a very, very transmissible infection.
And that's why we get those public health alerts, right? If somebody who had the measles was in an area, say a waiting room, an airport, wherever it may be, that you're made aware that you could have been exposed given how contagious it is. I also want to ask how difficult it can be to predict how sick someone might get and who is the most vulnerable when it comes to this virus.
It's usually children and typically children under 1 because they're non-immune. The first dose of the vaccine is given at age 1 as part of the routine childhood immunizations. The second dose is usually given at around 18 months or before a child enters school. But yeah, it's sad that those under 1 are most vulnerable. And of course, people who are immunocompromised, they might have an underlying medical condition or take certain medications to reduce their immune system to combat a various disease. And those individuals can get very, very sick from this as well. But I think it's important to recognize that anybody who gets measles can get very sick. We had a death in Canada last year. There's been 2 deaths in the United States this year, and there are about 100,000 measles-related deaths on the planet every year. The vast majority of those are in children, and the vast majority of those are completely preventable with routine childhood immunizations.
Dr. Bogoch, I also wanted to ask you about this report we were seeing out of the U.S. where they're hearing rumors of people throwing what are considered measles parties. I think the idea behind that is someone who has the measles is exposing others. The idea, or the hope that they build the immunity. Can you speak as a physician what the risks would be in doing something like that?
Well, if that's true, that's insane, right? We know that this is not a benign illness. Yes, of course, we always heard that decades ago, everybody used to get this infection and you'd recover and be fine and have immunity afterwards, but that's not entirely true. Well, it's true that decades ago, everybody used to get this infection. They were not all fine. And if you look at high-income countries, Canada, United States, some European countries where you see measles, the rate of hospitalization in high-income countries it's pretty significant. It ranges from about 8 to 25%, depending on the outbreak that you're looking at. So this is not a benign illness. People can get sick, and sadly, of course, we heard of people dying from this. So this should be avoided. The vaccine is free. It's widely available. It's got decades of safety data for it, and it's extremely effective. Is it 100% perfect 100% of the time? No, nothing is, but it's still extremely effective in preventing measles infections at an individual level. And then, of course, when you have high rates of population immunity, when you get an imported case, when you have enough people vaccinated, you don't see these giant chains of transmission within the country, which is what we're seeing now, unfortunately.
Yeah. Dr. Bogoch, thank you so much for your time and your take on all of this morning. We certainly appreciate it, sir.
My pleasure. Thank you.